Hello, everyone. Welcome to the Lunch and Learn. My name is Dr. Kathy Pender, and I'm a faculty member at Aurora College in Yellowknife, Northwest Territories, and I'm a member of CASN's Research and Scholarship Committee. I'm happy to welcome you all to this Lunch and Learn presented by CASN's Research and Scholarship Committee. And the presentations in the series focus on nursing workforce. So first, I would like to begin with a land acknowledgement. And CASN's national office is located on the territorial traditional land of the Algonquin people. And we would like to acknowledge and pay respect to the Algonquin people who are the traditional guardians of this land. We acknowledge their long-standing relationship with this territory, which remains unceded. We pay respect to all Indigenous people in this region and in all regions across Canada. We also acknowledge the traditional knowledge keepers, both young and old, and we honor their courageous leaders, past, present, and future. So Lunch and Learns are a popular tool in academia to encourage scholarship. Faculty members come together during their lunch hour to share their work, to network. CASN's webinar series, presented by the Research and Scholarship Committee, aims to recreate the collegial feel of the Lunch and Learn and is intended to serve as inspiration and a networking opportunity. Nursing faculty from across the country present on scholarship projects and discuss methodologies, successes, or challenges they have encountered in their work. So just a little bit of information here. We will be recording today's session and begin with a presentation from our speakers, and we'll conclude with about 15 to 20 minutes of question and answers after the presentation. So to submit a question, please use the chat function at the bottom of your screen there. So in this session, this is very exciting. We will hear from Dr. Melanie Lavoie-Tremblay from the University of Montreal and Tina Gelsomini, Project Officer of Transforming Nurses Work Environments through a Strengths-Based Leadership and Management Training Program. Okay, so this presentation is entitled COVID, What We Learned About Methodologies, Successes, and Challenges Encountered in Our Nursing Workforce. Thank you for presenting today, and we look forward to your presentation.
Thank you so much, Katie. So it's me who will begin. So thanks for the invitation. When we spoke, Don and myself, I think last May, we thought that it would be a good idea to present this lens, about the nursing workforce research. To look first of all a bit the literature review about this. So what the researchers, has published about their challenges, so what they learned, and then to have a concrete example. And Tina is here with me. She's our project officer, and we thank her each day since the pandemic started, because we did face several challenges with this partnership grant. So I thought it would be better that she's present this part, because she was there each day, to facilitate and to support the research team. And then I will be pleased, that we can discuss all together about, there's been challenges, but good things happen as well, and that learnings and things that we will keep doing. So that's what we will discuss about today. Yeah, so that's the description, and then I put my email on the chat. So if you want to have the slides, you just have to email me. That's fine. So we have a note just before starting. So it's true that we talk about, the challenges that we've been through research, but it's never, as the nursing and nurses themselves, they lived through the last year to the pandemic. So we just want to acknowledge, how the works, that they've done and are currently doing as well. And, conducting nursing workforce research during a pandemic underscore, how important it is to support nurse and to report as well on data about their well-being. So thanks to all nurses. So first of all, when we, we talk about this topic, so let's see if someone, publish something about the overall quality, because we can question ourselves, about the pace, the research has been done during the COVID and the publication as well. So there was one publication that's been
I
done
didn't
by,
sound like a redneck.
oh, I think someone need to mute their micro.
No, just
Okay, so or I think Tina, you can maybe mute as well. Okay, good. So for the overall research quality, so they look the clinical trials that you can have all access, and over 1,000 research studies that has been published. There was 33 that has been withdrawn. So they realized that they have issues about the method, the consent, the interpretation as well. So yes, we did see, some studies that was not the quality, but overall, the research has been published was of quality. And as the author mentioned, it was a sprint, for those who have conducted research during this period. And thanks to the institutional review boards, because we've seen that they have to adapt quickly to prioritize the COVID-19 study, that they bring experts in so that they can review this in a fast pace, but to ensure that the scientific integrity was there. So I think it was a big learning, knowing that it might be the first pandemic that we live, but it will not be the last one. So then we look at some publications more specifically about nursing, about the nursing workforce and research. And then I will just highlight some of them. And then we will realize that most of the challenges or opportunities that has been published is about the technology. So for those who have been involved, we have to follow regulations. So depending of your, Canadian jurisdiction or regulations about the institution, the hospitals, or the university as well. So that there is no way that we can go to the sites, to the hospitals. We might, be able to conduct virtual study visits. That all the large gathering was canceled. We have to postpone several research study, but thanks to the most of the agencies, we were able to, to postpone the amount of money. Sometimes that we are able to postpone, but didn't have more money. So there was issues as well, with people that we were hiring. But I think that we were able to adapt. But for the PhD students and master students, there was some issues because they had to, to finish as well on time. So we had to adapt their research ongoing. All the traveling was limited or even canceled. And then we have to adapt. And I think, it was a good opportunity as well to learn new approaches. So for instance, a PhD student were doing observation as a data collection, then we have to adapt, to change, and to learn. So is there an example that one of my PhD students try, photo voice was something that I was not used, as a method. So to ask nurses to take pictures, of what they find very relevant to discuss with us. And then after that, we can interview them through Teams, and then they can share the pictures and talk about this. So here is an example of a picture. So one picture can tell a lot as well. So we have to learn. So for the next one, then it's not only in research. So I think even talking to our family and friends, so increased use of phone, online meetings, email, social media as well was sometimes a new learnings, for recruitment, and to be able to see with ethics how we can use wisely. Then the use of Zoom for interviews, WhatsApp for mobile instant messaging, ethnography, the online journal entries, social media, electronic e-consent. So I think that's for some specific study that was very useful, when we have people or participants that they can access to a computer and then they can understand how to use it. But for other population, that was not possible, to do this. So we certainly have some challenges with this, and then to secure the research data. So what we learned through the the research that has been published about this, it's that we need, to question or to make sure that we obtain, proper, valid, and consent form from participants, that we protect the data when we work from home, to ensure that, how we recruit, some research groups. Nurses was a perfect example, that we want to continue doing research, with them, but in the same times, we knew that it will be difficult that to have access to them, even for some populations, like in the ICU, that was, we were not able to do research in those units. So we knew that there were some challenges about the retention as well of the participants if we're doing longitudinal study. Then we had some questions, I think, for those who are doing research with nursing workforce, I would say ethical research. Are we doing the study or not? We know that, they are overwhelmed, they are there to work, to protect us. And then in the same times, we want to collect data to tell, what you're living, what you're going through, to have some data to support, to influence policy as well. So some researchers, write about this, and Tina will discuss as well that we did have this discussion as well, and how we can do to reduce, if we move ahead, to the burden, of doing research, if we can do shorter surveys or short interviews. So we've been through this questioning as well. And then again, for the new research collaboration, so for us, we were lucky because we did have the chance through this big partnership grant to meet a first time in person before the COVID, but for other research teams, we didn't have the chance, or other groups, and it's sure that it's not the same connection maybe that we can have, and then we need to find other ways to make it happen as well, this team cohesion when we all working together through participatory action research, for instance. And then some researchers find difficult, to do sensitive interviews with participants that you cannot, be in person, to have a sense to it's not personal as well when we do this virtually. So there were some challenges as well highlighted. Then what we can learn, what innovations or that we will keep, through this journey. So when we look some of the papers published on this, it showed that we have been able to access certainly participants that we were not used, or it was difficult to access because they might be far away, or that we didn't have, it will be difficult, to connect all those persons together in the same times, in the same virtual room, things like that. So certainly that I think that we learn, how to do group meetings, to have people in the different waiting rooms, and yes, so it works well as well. Certainly, it can be more rapid and less expensive when we don't have to travel or to go to each site. Some researchers find the Zoom and Teams, we had the valid data as well during those interviews. And then the virtual interviews allow for more flexibility to scheduling the data collection from participants that they are physically far apart. So those, we want to keep this, I would say, this avenue, this tool. And then some researchers, I'm sure that you know some of them, that they were not able to separate, to their work and their personal life. So working from home was difficult. So it was good that they are coming back at the office, so that they don't, that they have a boundary. And some researchers didn't like, doing interviews virtually, and we had a lot of an interruption as well. That it's like the internet or the Amazon delivery coming to our house. So there was some disadvantage, but a lot of I would say technology was very useful and that we will continue to use them. So the general recommendations when we do look an overview, a quick overview, what has been published, it's that yes, we should anticipate higher non-response rates for sure, and then we need to make sure that the use of technology don't impact the validity of that data, and then to increase the debrief that we have among researchers to make sure that we are on track and everything is going well. But when we look at this, what has been published, we didn't find a lot, most likely nothing about, what has been, done for the intervention. Because here it's good to talk about, data collection, but a lot of our research among nursing workforce was to, implement interventions. So what has been the challenges? What did you learn? So this is where that we thought it would be great that Tina share our journey through this partnership grant, and to give a concrete example about how do we adapt an intervention through the COVID. So I will let Tina continue. Thanks.
Thanks so much, Mel. So as Mel just mentioned, I'm going to take over from here to discuss what our lessons learned for in our specific research project, which is the SB&H Leadership Partnership. So as Mel mentioned, there are not a lot of literature findings on how to adapt an intervention. So that's what we're going to zero in on now. This is what we're going to cover today. So I'm going to start by presenting some general background information on our study in the context of our research project. Then we'll together consider how we adapted our methodologies and interventions in response to the pandemic, specifically by reviewing two separate phases of our study. Once we understand how the interventions were adapted, we'll reflect on how the pandemic impacted our recruitment and timeline as well. Then we'll take a quick look at the major challenges and opportunities for delivering our primary intervention online, which was the Strengths-Based Nursing and Healthcare Leadership Program. And we'll close with some key takeaways on what the overall lessons learned were from how we responded, made decisions, and adapted our study during the pandemic. So a little background information. Sorry, my face is changing color with each slide that I show. So our study is entitled Transforming Nurses' Work Environments Through a Strengths-Based Leadership and Management Training Program. That's quite the mouthful, so we just shorten it to SB&H Leadership Partnership for short. The project is directed by our principal investigator, Lori Gottlieb of the Ingram School of Nursing at McGill University. Dr. Gottlieb is the developer of Strengths-Based Nursing and Healthcare, which is a philosophy and value-driven approach to guide clinicians, leaders, and educators to transform the healthcare system by humanizing care. I am our project director, so I'm responsible for project management, timeline, budget, use of resources, hiring, and the overall coordination of the study. This study is funded by the Canadian Institute of Health Research and the Social Sciences and Humanities Council of Canada through their joint Healthy and Productive Work Partnership Grant Initiative. So basically that means that this is a multidisciplinary partnership study with co-investigators that are coming from both health sciences and humanities disciplines. The study takes place from 2018 to 2024, and we have over a $2 million budget to conduct the study. It is a scale up of a partnership development grant that was received from 2016 to 2018. So with this phase of the study, we basically have more partners, more researchers involved, a greater pool of funds and resources to pull from. And we now have 8 institutional partners, which includes 5 major healthcare institutions across Montreal and Toronto. So we have Holland Bloorview and Sick Kids in Toronto, CU Centre-Ouest, CU's West Island, and McGill University Health Centre in Montreal, as well as our host institution, McGill University, Concordia University, and the Canadian Nurses Association. And just one final piece of background info. I think it's important to note that we also have an executive committee, which is made up of our director, Lori Gottlieb, my co-presenter and our co-investigator, Melanie Lavoie-Tremblay, another co-investigator, Bruce Gottlieb, as well as myself as the project officer. And this committee meets weekly to monitor our study progress and move the study forward. This really dedicated committee has been super helpful and active as we've navigated the many challenges of the pandemic. So again, some more background info, just wanted to lay out what our project objectives are and what we're trying to do. This is a healthy, productive work partnership. So we're really looking at the work environment. We are aiming to create a major shift in work environments for nurses by focusing on strengths-based nursing and healthcare leadership, which is derived from strengths-based nursing and healthcare. We are hoping to empower those clinical leaders to positively transform workplace cultures and nurses' work environments, to enable those healthcare providers to practice from a strengths-based lens and eventually result in better outcomes for patients and families. So as I mentioned, this study is focused on strengths-based nursing and healthcare leadership. So I thought it would be nice to just show the values of strengths-based nursing and healthcare leadership so that we can consider those, as they've also anchored our thinking as well a lot. So as we discuss challenges and successes in the context of the pandemic, like I said, it's important to take a step back and consider what was guiding our decision-making and processes. And as you can see in this figure, our decision-making was really guided by both those project objectives to improve nurses' work environments, as well as the values of strengths-based nursing and healthcare leadership, which is what we're espousing. These two things have really pushed us to be collaborative and values-driven in our research project management and how we've responded to the challenges brought on by the pandemic. So with that kind of overall framing in mind, it's time for us to consider how the pandemic impacted our major planned activities. So here on the slide, you can see just what were the 5 major planned activities for the research project, kind of in the pre-pandemic visioning. Our goal was to develop and refine the strength-based nursing and healthcare leadership program. As part of that process, we were also planning to film at 2 hospitals to create story sharing materials for use in the program. Then we were going to be delivering the program in person to up to 125 nurse leaders and managers from those 5 partner institutions. We would evaluate the impact of the program and then conduct robust knowledge mobilization. However, the COVID-19 pandemic arrived as we were in the process of refining the program and preparing to film at 2 different hospitals. So really this happened quite early on before we had started implementing our methodologies and intervention. So we're going to take a look at how the pandemic impacted us and everything that we had planned next, how we responded and adapted, and what those key challenges, opportunities, and lessons learned were. So I'm going to start by just recounting how it impacted our specific methodology, which was called story sharing for pedagogical purposes. This phase of the study was meant to involve filming at hospitals for us to create what we had called story sharing materials. Those story sharing materials were meant to be short story-based documentary films, which we would create by filming at hospitals and then edit together and use in the SBNH leadership program to provoke reflection, discussion, and sharing by program participants. So what was the situation when the pandemic hit? As the pandemic hit, we were in the final stages of preparation and approvals to begin filming at those 2 different hospitals in Montreal and Toronto. We were very quickly impacted by the realities of the pandemic. There was, as Mel mentioned, I believe there was a ban on in-person research with humans that did not have to deal with the COVID-19 pandemic. So that actually made it impossible for us to film in the short term. This was also a period of incredible unknowns regarding the duration of the pandemic, the full scope of the impact that it would have on our partners and on our project. And at the same time, we had responsibilities as publicly funded researchers to, deliver our project and deliver results and use those public funds responsibly. We also, from a research perspective, had spent a lot of time and resources on developing the story sharing methodology and knew that it had value. But again, we had those constraints and we had to deliver. So how did we respond? After weighing the realities of the pandemic, as well as our obligations as publicly funded researchers, we made some decisions and put in place a plan of action. In the short term, we immediately put the filming on hold for several months since it was impossible to conduct it during the ban on in-person research with humans. And as Melanie mentioned, during this time, researchers who are conducting nursing workforce research really needed to consider whether or not we should proceed with our research in the context of the pandemic, or whether it would place too great of a burden on nurses and healthcare workers. So we weighed all of this, and our executive committee, in discussion with our stakeholders, ultimately decided that the best way to support a healthy work environment in this context was to cancel the filming and to remove this burden from the nurses and the healthcare workers that were in the units where we were intending to film. So instead, we focused on finding alternatives that would still allow us to integrate story-based materials into the program, but without negatively impacting the workforce. So we decided to return to that earlier phase of the study that I mentioned, in which we shot some films in 2017, and we went back to that footage and created updated materials to use in the program. We also looked around at the existing media stories on nursing and nursing leadership and used some of those materials in the program. So we did reach a good solution, but there were certainly some challenges along the way. First, it impacted the role of our Concordia-based researchers who were supposed to be taking the lead on the filming. There was also a period of disappointment and low morale because we had invested so many resources into preparing to conduct this filming. And most challenging, I think, for me as the project manager, is that we had to roll back on our commitment to research staff and consultants that were already in place. So we had a filmmaker, sound recorder, an editor, an assistant editor, a nurse researcher, and all of those people's roles were impacted by our decision not to film. But that said, there were also some opportunities. Kind of a silver lining of the early pandemic was that there was a lot of increased media attention on nursing and so many more stories in circulation. And we were able to harness that for use in the program. It was also an opportunity for us to be creative and to spend more time with the footage that we captured before, which was rewarding for the researchers who were involved in that aspect of the study, and was also an opportunity for the filmmaker and editor who had been on standby to film to also have some work. So now we're going to switch gears and consider how we adapted our primary intervention, which was the strengths-based nursing and healthcare leadership program. Before the pandemic hit, our plan had been to deliver this program, which involved a training and mentorship component in person, beginning in what we thought would be fall 2020. But once again, we were in a situation where we were confronted with the realities of the pandemic, which in the context of professional development activities, many institutions were pausing these educational activities. And of course, there was an ongoing nursing crisis. We also continued to be bound by our responsibilities and constraints as publicly funded researchers. So once again, we kind of quickly realized that we needed to reconsider our plan to deliver the program in person. We used sort of a spiraling process, which is a tool of strengths-based nursing, as well as a lot of ongoing dialogue with our partners to make a decision about how to adapt our intervention. So in May 2020, we launched a remote learning subcommittee to explore, zero in, and work out a proposal for how we could transform our intervention to remote learning. In fall 2020, we presented that proposal to the partners to receive their buy-in and approval to move forward. And we received approval from them at that presentation. And so we spent the next few months adapting the program and preparing for online delivery. So that was quite an extensive process, which involved building an online learning environment, consulting with all of our faculty to help them reimagine how they could deliver their activities online, creating lots of online learning tools and materials to ensure that our program would still be very active and engaging. So as you can imagine, this was quite a big pivot, and there were some real challenges as well as real opportunities with this transition. Remote learning was not part of our original plan, so it required a whole new range of competencies and expertise from our team that we didn't have and had to go out and recruit. So we spent months recruiting an online course designer and a technical assistant, as well as adapting the roles of the existing administrative team. We also came to realize that online learning required more preparation by our large group of 25 faculty who had agreed to co-facilitate our 12 training modules. And most of these faculty were actually nursing and healthcare leaders who were already under very tremendous professional strains in their primary workplace. So this required a lot of flexibility from all of us, as well as tremendous commitment and generosity by those faculty to whom we are still exceedingly thankful. So it was a challenging time, but there were some really exciting opportunities. It pushed us to be very rigorous in how much we prepared and documented the program. And it also resulted in an unexpected tangible output for the study. So by the end of it, we had created a very high quality online learning environment, which is hosted on McGill My Courses. So once we had adapted and prepared the program for online delivery, it was time to recruit participants. And in this section, I'm going to just quickly cover one example of some of the challenges that we experienced with our recruitment and timeline by looking specifically at our second cohort. So again, just setting the stage for our second cohort of participants, we were scheduled to recruit from January and February 2022 until launch the program in March of 2022. As you may be thinking, this timing coincided with the Omicron wave, which was absolutely overwhelming hospitals in Montreal and Toronto, resulting in an ever worsening nursing staffing crisis and high levels of burnout. So it goes without saying, skip the slide. So our executive committee had to respond to this situation very quickly. We immediately paused our planned recruitment activities that were supposed to begin in January 2020 to remove any pressure on our partners related to our study. The executive committee then met several times to discuss possibilities and to strategize alternative options and timelines. During those discussions, we really put every option on the table, including potentially canceling the second cohort altogether if it was in the best interest of our partners, or delaying the timeline significantly, as well as by just a limited amount of time. So we put all the options on the table. Once we had those concrete alternatives in hand, we shared the options with our clinical site leaders at a roundtable to review the options, receive their input and suggestions, and reach a collective consensus. We ultimately reached a collective decision to delay recruitment and the program launch by 6 weeks, as well as to condense the training schedule so that it wouldn't coincide with the summer when we were anticipating additional staffing shortages. So while we were giving our partners every option, this exercise was a really important opportunity for ourselves as well as our partners to articulate that supporting nurse managers with leadership and mentorship experiences was even more crucial in this context, and that they were committed to continuing the momentum that was gained through training the first cohort of leaders. So to summarize, it really goes without saying that this was a very challenging period, particularly for the clinical partners who are facing urgent staffing needs and a burnt out workforce. In this context, we also understood that it was difficult to release staff for the 6 full days that was required to participate in the program. As well, once recruitment was underway, we anticipated recruitment and retention challenges for sites, especially sites that had COVID units. And while we did see a bit of a drop off in participation, our recruitment and retention was strong overall. We had 121 participants complete the program out of our goal of training 100 to 125. So we were right within our target. Overall, these challenges presented an opportunity for us to practice transparent communication with our partners and for all of us to reinforce our collective commitment to the research goals. So finally, we did deliver the strengths-based nursing and healthcare leadership program. Our first cohort of the program ran from September 2021 to March 2022 to a total of 55 participants. It included 6 days of training, 6 months of sustained mentorship, the resources and support to advance an optional change project in their workplace, and finally, a final celebration to cap it all off. Our second cohort of the program ran from May 2022 to October 2022 to a total of 66 participants. And of course, delivering this intervention online presented some overall challenges and opportunities. Delivering online required increased onboarding time for participants, which was challenging because this was a time when they had limited capacity to deal with anything else outside of the demands of the workplace. There was certainly a learning curve and Zoom fatigue for all of us. And of course, there was also the lack of the face-to-face relationship building. As well, as Mel also found in the literature for other studies, we did experience lower than average participation rates in the evaluation research. However, there were also many opportunities. It really did push us in many ways. It pushed us to build greater flexibility into the program for learners so that we could adapt to their realities. It also removed the geographical barriers which separated the Toronto and Montreal institutions, and we capitalized on this by training participants from Ontario and Quebec together in the same cohort. And we also assigned an Ontario and Quebec-based facilitator to each training module so that we would get an interprovincial perspective. So that decision resulted in new opportunities for cross-provincial exchange and learning. Finally, and perhaps most importantly, our evaluation results to date have shown that the mentorship has been a really meaningful aspect of the program, perhaps the most meaningful, and that it provided participants with an opportunity for exchange and support during these difficult times. So to sum it all up, our key takeaways. The pandemic, first of all, definitely forced us to be flexible and creative with how we adapted our interventions and methodologies. The working conditions that were exacerbated by the pandemic also underscored the relevance of our nursing workforce research, as well as our potential contribution that we could make to the field by looking at work environments. Indeed, our results to date have shown that we have increased leadership capabilities in the participants that took the program. Ultimately, the pandemic conditions also strengthened our relationship with our clinical partners. It provided our research team with many opportunities to practice solidarity with clinical leaders, managers, and frontline staff, and to build a truly collaborative partnership. The pandemic also increased our collective commitment to the research project and its goals. And finally, it gave us many opportunities to walk the talk of SB&H leadership and to strive to integrate and model these values in our own project management and decision-making. So here again is our strengths-based nursing and healthcare leadership value wheel. So you can see that we really were guided by many of these values like systems thinking, timing, readiness, and learning, and multiple perspectives. Thank you so much for listening to our presentation. If you'd like to connect with us, here are our emails, the Twitter for the Strengths-Based Nursing and Healthcare Leadership Partnership, as well as our website. Thank you so much.
That was absolutely wonderful. Thank you. And I can certainly hear the angst in your voice when COVID hit and then Omicron hit. I couldn't even imagine. So if we were anxious, yes, you would be anxious too. So thank you so much. That was absolutely wonderful. I'm going to turn it over now for a Q&A session. So please send your questions in the chat, and we'll take it from there.
Yeah, and if you have any experience to share or any learnings as well to share with us, we would be pleased to learn about it. And Tina, maybe you can stop sharing the presentation so we can see each other. It's good.
Excellent. So. Questions? I'll ask a question then. I'll just ask it since I've got the floor. I guess looking forward and knowing that this could definitely happen again and is a reality, do you have any additional insights or things that you would do a little bit differently? Because there have been a lot of positive things that have come out of COVID, as you mentioned. So I'm just wondering about that, or any additional sage advice for us going into something that's longitudinal?
But further advice, depending, you know, who are the participants, but certainly there is some technology I found very useful, like when we work with managers, nurse managers, you know, the e-consent, it depends on the ethics board, but you know, it's something that we can certainly continue to use and be able to explain ahead with the participants, and they are used to, you know, to use the technology, then to do teams interview by team. So that was a great flexibility for nurse managers, I find, because they were able to text us, you know, to say, well, you know, I may be late, you know, 15 minutes or things like that. So then we knew that when we plan an interview, we will plan like a 2 hours space, to make sure, and then they don't have to worry that we were sitting somewhere. They just text us, and then we were able to go. So I think that there were some aspect and for doing research with nurse managers that we will keep, and I think that was useful for both ways. Yes. I think that we have a question. Yes.
Thank you. Yep, go ahead, Sue.
Hi there. Bonjour, that's my French for the day. I tried. Anyways, I can't ask the question, or I can't make the comment in French, but I'll just say that thank you for the presentation. I think it's a great example of when you think about research methods and you think about designing interventions, that the ability to adapt is really key in terms of aiming at effectiveness, right? And your final results. So I think it's a really good example of how we have to be as researchers flexible in terms of thinking about adaptability, feasibility of interventions in order to, so that you didn't have to give your money back from the funding, right? So that you can actually carry out the study. So I think it's a great example of that. And it shows the reality of having to do research during challenging times. But at the same time, you saw some really positive outcomes. So well done, congratulations. And yeah, just wanted to give you that feedback.
Thank you. This is very nice from you. Yeah, and and it's been and we're grateful to have such key partners. The clinical side that we were working with them, and it was them who said that if we should moving ahead or not. We were ready, as Tina mentioned, to cancel, because it's them who are living all those things. But they were saying, you know what? Can we talk something else? They didn't want to talk about COVID anymore, and they see this an opportunity just to to be together, to talk about something else, to be with other leaders and to share. So yes, sometimes we can be surprised. It's not the first time that I'm surprised with the research and our participants, because when you do research with nurses, we know they're always busy. It's always something extra or that we are asking from them, and often, we have a team who are volunteer. They will be more than happy, to embark in this new journey. So we are always amazed, that they have this energy. They want to learn. They want to be together, and they see an opportunity in this. So you're right. Yeah, we've been blown away by their resilience, and learn from this and take the opportunity. Yes, you're right.
So Dawn here, I just have a quick question. So the people who took the course, what were sort of the criteria for choosing them? And from that, do you think it would have been, people would have been different if indeed it had been the pandemic? Like, would there have been a different cohort, different groups of people who would have been doing the course if there hadn't been the pandemic?
Tina, I will let you answer at the beginning. Yeah, you're good.
It's an interesting question. Would different people have ended up in the participant pool? I mean, certainly it takes a specific kind of person to invest that time and that headspace, that mental energy during the pandemic. But in terms of our inclusion criteria for the study, we had overarching inclusion criteria, which was to select nurse managers, people who were overseeing nurses, or some clinical nurse leaders, some nurse educators. So we had pretty broad overarching criteria, and then each site devised their own specific criteria. Since, as you may have heard from the list of participating institutions, we had a really vast number of sized institutions. We had Holland Bloorview, which is a small children's rehabilitation hospital. And then we also had 2 CUSs and McGill University Health Center and SickKids, which are quite huge. So they had their own metrics for specifically how they wanted to map out either spreading the managers over different locations within their institutions, or having kind of strength in numbers in specific areas. So we left that to the sites to decide how they wanted to target recruitment.
So yeah, we might, you know, the nurse who have a unit COVID, you know, might not be able, you know, to participate, or because they were busy, or so yeah, so maybe there were some people who had wished to participate that they did not yet because of their the constraints. So yeah, and now we are looking for the sustainability. So by having this, you know, virtual or online program, so how we can move from now. So for those who didn't have the opportunity, and yeah, to see what we will. I hope there will be more. We don't see any big waves coming. So if we can plan something else, or we are looking to have our next partnership meeting in person to reconvene together. So we are looking forward to see how we will continue this, having all the material ready online, but in some times we are going back together. So maybe to think about a hybrid, or what we can do. And for the mentorship program as well, he allowed some mentors to do group mentorship, because when you are in person, we were thinking that it would be more one-on-one, or maybe more easy. But then by being virtual, we allowed as well to have a group, you know, a mentorship group. And we've seen that despite the program is ended, that some participants continue, or the relationship has been built, you know, and since that they can do this virtually, they can continue as well to meet. So it's great to see this going, and then how we can come back. So we went to very far, you know, to adapt. So then we have to see how we balance, you know, for the next steps. Yes.
This is wonderful. Are there any more questions? We have the contact information for Melanie and Tina. And so at this time, I'm just going to thank you so much for your presentation. It was absolutely wonderful. I learned a lot. And one of the barriers we have in the Northwest Territories is bandwidth. So my camera actually quit because of the bandwidth. So this is one of our barriers up here. And I kid you not, it's a multi-billion-dollar investment of the territory that will have to be completely redone. So, and things we don't often consider, right? In this modern world. We do not live in igloos. I'll just emphasize that. But thank you for the information. I do want to highlight that this recording of the session will be available on CASN's YouTube channel and circulated to everyone within the coming days. I can't wait to see that because I want to review some of the resources. And please feel free to share the link within your networks, of which I will also want to do. I've taken a lot of notes. Thank you everyone for joining us today, and CASN certainly hopes you'll consider joining us for the next Lunch and Learn. So mark your calendars for November 23rd, when Dr. Charlotte Ross will have a presentation entitled Research into Nurses' Mental Wellness and the State of the Nursing Workforce, Shifting the Lens of Inquiry from Our Functionality to Our Being. It sounds like another fascinating one, so I sure hope you can join us. And thank you very much for coming. And thank you, Melanie and Tina. That was fantastic.
Yeah, and,
really
and thank you for
it.
the invitation. And I just want to say to some colleagues that I can't see their names. So thank you for being there as well. And thank you, Tina. It was a pleasure.
Thank you so much for having us.
Thank you very much. Merci.
Merci. Bye-bye.
Au revoir.